TAVR is a minimal invasive procedure where interventional cardiologist, with the help of a surgeon, can replace your diseased aortic valve.
Now, in the past, we used to replace the valve surgically, where patients had to go for open heart surgery. Nowadays, we can do this procedure, minimally invasive, and we can go through the groins and go with a stent that has valve inside. Sometimes we use alternative access, like the neck, but most of the time we use the groins.
Typically, TAVR has a quick recovery. Usually, you expect to stay in the intensive care unit for a couple hours, sometimes for one night. Usually, you can go home in a day or two. We'll give you a detailed instruction on what you need to do at home, and we'll go over your medications before you leave. We'd like to see you in the office at 1 month and at 1 year for close follow-up.
This procedure is approved for symptomatic severe aortic stenosis, or if you already had bioprosthesis in the aortic valve and now it's stenotic, TAVR is also indicated for that if you have symptoms. What are the benefits of TAVR procedure? The first benefit is survival benefit. So we expect patients to live longer after replacement of the valve. 2, symptom benefit. The symptoms resolve. We expect them to feel better. If they had shortness of breath before, we anticipate improvement in shortness of breath, chest pain, and if they had any syncope before, we also anticipate resolution of the syncope symptoms. Watchman implant, it's a small device that we place in the left atrial appendage to block it, and this will decrease the risk of strokes in the future for patients who cannot take blood thinners. The way the Watchman implant works is by blocking the left atrial appendage in the heart. It turned out that if you have a fib or irregular heartbeat, 90% of the strokes that come from the heart come from the small appendage. So by blocking that appendage, you decrease the risk of strokes in patients who cannot take blood thinners. So what are the indications for Watchman procedure? So first, you need to have a regular heartbeat called AFib. And then if you have AFib and you cannot take blood thinners, whether you're high risk for fall, or you cannot afford the blood thinners, or you have bleeding from blood thinners, then there is indication for Watchman procedure. Watchman procedure is one-time treatment for life.
If you have any questions or you would like to make an appointment, please call us at 985-230-7380.